first question will come up. Let's put 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some of the answers here. So Gillick competence is one of those really tricky things that I think we all know of. We have an idea in our head, but ultimately it comes down to maturity and understanding. So the first part of Gillick competence or assessing Gillick competence is that the patient actually has the maturity to manage influences on their decision making. They're not going to be unduly influenced positively or negatively in any way. They're able to actually independently make up their own mind about the decision. So the next part of it really is about the understanding, and with that comes they have to first of all have the ability to understand the medical issue. They have to understand the proposed treatments. They have to have the ability to weigh the benefits versus the risk of all the treatment options, and of course the ability to actually communicate the decision clearly. So all those first bits are going to get you 2 marks. The ability to communicate the decision clearly is slightly less worth a mark in there. And it's really about that kind of patient autonomy, capacity and competency assessment as we do multiple times a day. Applying the Gillick frame in particular really has that little aspect on, do they actually have that maturity? Do we think they've actually hit that maturity milestone, so to speak? Coming in from the chat here, we've got demonstrates independence in daily activities. Yeah, and I think that's a good little proxy of, do they have that maturity? Able to understand harms of treatments, fantastic. Benefits of treatments, fantastic. Able to weigh up harms and benefits to arrive at a decision. Yes, yep, good. I would be a little bit nervous about having the harms and benefits, then the ability to weigh up, although it is, I think that is pretty appropriate actually. I would consider rewording just to avoid that potential thing around diversity of answers, but I mean, really it's the same thing as so just worded slightly differently. Definitely be getting 4 marks there, I'd say. Very well done. Okay, now we've all had those tricky cases where we've had to kind of decide for ourselves, does this patient actually have Gillick competency? And I think on top of that as well, you also need that little bit of a pub test, so to speak, a little Australian colloquialism of, if you were telling this story down at the pub, do you think people would be looking at you a bit funny? And if in your head the answer is, I'd probably get a few odd looks, to have an extra, maybe a bit of a think about the decisions you're making. One way to look at it, I guess. Not legally binding. Of course, let's move on to the next question then. So we'll put 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at the answers. So it's not uncommon for questions in the KFP exam to be based off procedures and describing how you do the procedures. And a part of that is, assessing, one, what the procedures actually entail. I'm saying procedures too many times. But also, how do you actually go about consenting that patient for it? Often it's around things like excision of skin lesions, but not uncommonly you'll get something, a simple procedure like intravenous cannulation. So, of course, the things are going to be gather all required equipment. Yes, spelling it out to something that simple is definitely worth marks. Identify a suitable vein, clean the insertion site with an antiseptic solution, allow clean skin to dry completely, insert the cannula at a shallow angle, advancing until blood return is visible, secure the cannula with an adhesive tape, and connect the IV saline for administration. I have realised that last one probably is not actually going to be given a mark, given the question actually specifies provide 5 specific steps required for intravenous cannulation, and connecting the fluids is not actually a part of that. So look, I'll kick myself up the bum for that one. Now, coming in from the chat here from Demir as well, we have apply tourniquet. Fantastic. Yes, would definitely get a mark for that, not in this list. But would definitely be worth a mark. Find a good vein, fantastic. Prepare your trolley, so yep, that's part of gathering all required equipment. Wash your hands, fantastic. Definitely wash your hands, and that should definitely be in my list. Aim and shoot. Excellent. Hopefully you're meeting with the cannula and not like with a shotgun or something, but hey, you cannulate the way you feel comfortable. Excellent. Let's move on then to question number 3. Let's get 2 minutes on the clock and your shooting time starts now. All right, time is up, and let's have a look at the answers. This is one of those really frustrating questions where there's lots of things you could do for this patient, there's a lot of things you would do for this patient, but what this is kind of asking behind the scenes is, what do you know about the current recommendations from the Australian government about managing online bullying and harassment? And so part of this then would be knowing what government pages to go to, what government resources to go to, and there is actually little checklist out there, and I'm pretty sure RACGP even put a little thing out as well a little bit back. But the big things there are: do not respond to messages, take screenshots to report, to keep the evidence to report. Not a part of this answer, but I think something just good to know from a practical viewpoint is that for a lot of people, actually having those things on their phone can be a source of distress. And so it's recommended that if that is the case, they should send the copy to a parent or trusted adult and delete the original messages from that device. Next thing, of course, is to block the offender from the device, services, or apps. Of course, we'd be specifying just one of those for an answer in the exam. And again, as a practice point, after you've taken the screenshot and secured that somewhere. Next step is, of course, to report the cyberbullying to the game/site/app that it occurs on. To report the cyberbullying to eSafety, so it's part of the commission to investigate and regulate eSafety. If you don't know what it is, I strongly encourage you to go check out their website and have a bit of a read, and this is where a lot of this material actually comes from as well. Report the cyberbullying to more than one trustworthy adult, and of course to report the cyberbullying to the school. Pretty much every school in Australia now has a cyberbullying policy and will have a process by which they manage that. Frustratingly, with various states of compliance or how serious they take the matter. I think we are starting to appreciate, though, just how pervasive it can be and how devastating it can be to a young person's life. Of course, coming in from the chat here, we have offered to disclose this to his parents with permission. Fantastic, and that's about that telling a trustworthy adult. Offer to disclose to his school counsellor. Fantastic, again, putting that notification into the school. And referral to Headspace for counselling. This is a tricky one because, yes, personally, I think we would do that in clinical practice. It doesn't specifically help manage the bullying itself, but certainly does manage his response to it. So I think it would depend on the question, depend on, sadly, the question author as to whether or not they would actually count this in for a point. Again, noting that in this exam, if enough people do give an answer, they do take it back and able and look at, do we actually put that in as a valid answer? And that one would be one that I suspect would go to that kind of process and would really be dependent on who actually wrote the question as to whether or not it would be accepted. Frustrating, and this is one of the reasons why I think the KFP exam is a source of frustration and difficulty for